Hello and welcome to Health Live at Seniors Today. We are here on an August evening, August Saturday, and as you can figure from my voice is slightly hoarse because I'm just recovering from a bad cold, and I thought it would be appropriate, not because I've got it, but because that's in the air, to have a session today on monsoon illnesses and their care. And we are delighted to have here with us Dr. Vedavati Purandare, who is the head of clinical care and a senior consultant and physician and diabetologist at the Chelaram's Diabetes Institute in Pune. I will introduce Dr. Purandare shortly. She is an MBBS and MD in medicine from the BJ Medical College in Pune, and she has clinical and teaching experience of nearly 2 decades. She has received the coveted Dhirubhai Ambani Scholarship and was awarded the late Mr. Vasant Baum Prize for her academic performance. She has a number of scientific publications in national as well as international medical journals. Her work on renal disorders and diabetes was presented in a conference at Spain. Dr. Purandare is a regional faculty for advanced certificate course in prevention and management of diabetes and CVD. She is also faculty at the MUHS fellowship at the Chelaram Hospital. She teaches theoretical and practical aspects of diabetes to undergraduate, postgraduate medical students and paramedical staff. She also conducts educational and awareness lectures and sessions for laypersons on various aspects of diabetes and lifestyle diseases. She submitted a dissertation on diabetes and kidney disease to the University of Pune. And this is, I think, a first, at least I haven't heard of too many such cases. And she was conferred the PhD medicine degree in February 2022. Welcome to Health Live at Seniors Today, Dr. Purandare. How are you?
Thank you so much, Mr. Pradyuman Maheshwari. It is really a pleasure and honor to be a part of such initiative. We discussed yesterday, and I really congratulate you for this initiative, and pleasure having you with in this program today. And I'm sure that we would be having a discussion which would benefit each and everyone who is participating in today's Zoom meeting.
I'm sure, Doctor. But before we go on further, tell me about this PhD. And you are already a doctor, a medical doctor. So yes. What got you to do a PhD in medicine?
So basically, in India, the research part is not that geared up because of so many reasons we know. And my professor and HOD from BJ Medical College, Dr. A.L. Kakrani, he was PhD guide in the university, and because of his blessings and his motivation, I could complete my PhD. And my father did PhD in education. So he always dreamt that one of the kids should do PhD. He is no more right now. But just to fulfill his dreams, I pursued this PhD degree.
I'm sure he is a very happy man wherever he is, Doctor. The session that we have today, as I mentioned earlier, I have a bit of a bad cold myself, but we have been looking at several cases of monsoon-related illnesses. I was speaking to somebody from an insurance sector last week, and he mentioned that the number of cases that even the insurance companies have received in terms of claims has leapfrogged this year. Yes. Clearly, there was a need, and many of our readers also asked us to have a session today, and which is why we thought we'll invite you to look at this issue. As always, all of you over here, Dr. Purandre has a presentation which she will make. And after the presentation is made, if you have any questions, please ask them in the Q&A tab, which is there on your screen. Ask the question, do mention your age and your gender. But before we ask the question, before Dr. Purandre, I invite Dr. Purandre to speak, is do remember that the advice given over here in this session is advisory in nature. There's nothing better than meeting a doctor yourself personally and getting a clinical examination done. Of course, post the lockdown, you can always speak with the doctor via teleconsult, consult a doctor online, and as you can do with Dr. Purandre as well. And but the best thing to do is to interact with the doctor one-on-one. Having said that, I would invite Dr. Purandre to make her presentation, and then we will address all the questions after that. Over to you, Doctor.
Thank you so much and welcome all of you to this session. I would like to thank my CEO, Dr. A.G. Unnikrishnan, for giving me this opportunity. And we will just, can you see the slides?
Yes, we can see it. We can see it.
Okay, good.
You can make it a full screen.
Yes, I am just on the way. Yes. So basically, I am representing Chelaram Diabetes Institute, a not-for-profit organization which has mission to create impact in the field of diabetes. In addition to diabetes, we do have multi-speciality hospital. We are into research in the form of Chelaram Diabetes Research Center. We also have on the right side, you can see a logo, which is Diabetes Health, which is bi-monthly magazine in English to improve awareness about diabetes. So just this is a brief slide, and we will discuss in next 10-15 minutes some brief about monsoon related illnesses and how to prevent or control them. We all know that just hearing the word monsoon is a pleasant transformation from a hot, scorching summer into a rainy and cooler, nature-friendly season, which we all love. But in addition to monsoon, in addition to rains, in addition to clouds, in addition to blossoming flowers, we also have some illnesses which are more commonly seen in monsoon. And why do we see them? Because as you rightly are seeing here in this photograph, there is rain. And if there is stagnant rainwater, which is getting accumulated roadside in the ponds, then the mosquitoes, they breed on it. So most of the monsoon related diseases, they are mosquito driven diseases. They are common during rainy seasons. Then most of them have common symptoms, like as Mr. Pradyuman was saying, that he has sore throat, there is body ache. Many of the monsoon related diseases have fever, lot of tiredness. People, they tell us that we don't want to get up from our bed and don't want to walk. So tiredness to such an extent, then reduced appetite, and patients also have severe body ache. So most of these diseases we will discuss one by one, but by and large, most of them, they have these common symptoms. And as we have faced recently COVID pandemic, which was not definitely related to monsoon as such, but monsoon related, we have seen epidemics and pandemics of dengue fever, cholera, malaria, etc. So these are monsoon related illnesses, and more so because of the moist and damp weather, there is no sunlight, and there is basically mosquitoes which are just multiplying day by day. So very commonly in this part of Pune city, Bowdhan also, we are seeing dengue fever, which is very common. The symptoms are patients will have high grade fever. Dengue fever is also called as break bone fever, as if the bones are getting broken. Such severe bone pain, muscle pain is there in dengue fever. Many of the times patients will have severe headache. Then there is pain just behind the eyes. Then patients might have skin rash. Then patients might develop diarrhea. So these are the symptoms of dengue fever. Then there are various blood tests which we check for dengue, like dengue NS1 antibodies. And as we all are aware that platelet count is a crucial parameter when we see patients with dengue, because dengue virus specifically attacks blood cell line, which is called as platelet. And if platelet count gradually reduces, then the chances of bleeding are high. So we have to be very cautious when we are seeing dengue fever patients and we do see platelet count below 20,000. There is no specific treatment as such for dengue, but the rest is a very important. Hydration. In dengue, if you see any patient, if day 1 hemoglobin is 13, day 2 it is 14, day 3 it is 15, increasing hemoglobin in dengue is not at all a good sign. If you ask me any patient, if he says that my hemoglobin is increasing, he would feel better. But in dengue fever, this indicates concentration. It means that the fluid from the blood is going into third space, that is pleural area, then abdominal area. So increasing hemoglobin is not a good sign in dengue patient. So in them, lot of fluid intake, 3 to 4 liters oral water has to be given to patients. Then IV fluid, sometimes we give it to patients. If patients are tolerating food and water and platelet count is normal, then 90% of patients with dengue fever can be managed in-house just by eating healthy food, drinking lots of water, eating healthy fruits, good fruits, and most of the patients, they recover. But if patient has had history of dengue maybe 2 years back, and this is the second dengue fever episode, then we have to be little cautious. We have to be little careful, observant, because the chances of this dengue fever second episode getting complicated is little high. So such patients, we give lot of observation. Then dengue as such is a Aedes mosquito-borne disease. So Aedes mosquito, it breeds on stagnant, clear water, and these biters are day biters. So if a office-going guy has dengue fever, then the chances that Aedes aegypti mosquito are in the office rather than in the house, where the person is more in the evenings and night hours. Office screening and office, we have to take care of people around him. Prevention of dengue is basically to avoid mosquito bites, to cover the containers with stagnant water, use mosquito nets, mosquito sprays, mosquito repellents, wear full sleeves or cover your body with clothes, and fumigation. If a lot of dengue patients are found in one area, then corporation does fumigation so that mosquito breeding is prevented or it is decreased. So this is all about dengue fever. Remember that it is severe breakbone fever. Don't worry. Even the muscle pain, bone pain is there. Hydration is the key. So hydration, rest, and if there is fever, then paracetamol. Please do not use NSAID painkillers, which are like Combiflam. They are not good. When you have diabetes, definitely avoid using those strong painkillers, which may not be good for kidneys. So rest, hydration, and if need be, paracetamol. These are the 3 pillars for dengue. And if you get dengue fever, don't worry, because 99% patients recover. 1 or 2% patients, they are observed in, or they need hospitalization, in whom we observe complications, and very rarely patients may even die. So this is dengue fever. Then coming to another mosquito-borne disease, which is malaria. We all know that malaria, the fever is definitely with a lot of chills, rigors. There is a specific time where the malaria comes, and the mosquito is Anopheles mosquito, which breeds on water. And in addition to chills and fever, patients may have jaundice, patients may have body pain, vomiting, loose motions, and malaria as such is not found in Pune. So if there is history of travel from a malaria pandemic area, if patients are coming from Konkan area, then to Pune, then we expect the malaria as such. So ask history of travel if the malaria pandemic region is not there. In malaria patients, we have to be vigilant for hemoglobin, platelets, for liver function test, for kidney test. So malaria, there are many medicines which doctors prescribe. There are types of malaria like Plasmodium vivax, Plasmodium falciparum. It can be combination of malaria. So these are all symptoms of malaria. Then in monsoon, where there is a lot of water getting stagnant in the ponds or in the farms, if farmers are working there, then this is a bacterial illness called as leptospirosis, not very commonly seen as such. But if patients have 3 things, one is high grade fever, and then there is bleeding from in the eyes, maybe conjunctiva, bleeding from anywhere, and patient has jaundice, then we anticipate that this could be leptospirosis, where the bacteria, by direct contact of water, they reach the human body. It is usually from the rodent urine, or dogs or human beings also. So basically, the bacteria from the infected animal comes into the water, and then direct contact through the skin, it comes into human body. Antibiotics definitely help in leptospirosis, like doxycycline. Again, hydration, rest, paracetamol, these are the dictums in all fevers which come in the monsoon season. Then in addition to fevers, then we also see lot many patients with loose motions, losing water like anything. So cholera is a disastrous loose motion entity. If not treated, if not hydrated well, can prove life threatening. So cholera is usually severe diarrhea, which is rice watery diarrhea. Patients lose water like rice water, and that might lead to severe dehydration. We have seen patients losing lives, means in one go they will lose 5 liters of water in one motion, and then they are dehydrated. So food and water hygiene is very important. While traveling, we should not drink water at any tap. We should be drinking safe and hygienic water. Food hygiene is definitely important. So don't eat anything which is cold served in the hotel. You can eat hot food like dal and hot rice. Hot dal, they can be chosen when you are traveling. So food and water hygiene definitely is must. When you are eating fruits, then either eat peeled fruits, or cooked fruits can be eaten. And then utensils also, we have to be very careful. Cholera is a vaccine preventable diseases. So when patients take cholera vaccine, then they can be prevented at least 80% of the time. So cholera vaccine can be offered to patients who are going to cholera area. Then again, enteric fever or typhoid fever. This is also seen commonly in monsoon area, monsoon season, where fever is there, which is high grade fever. We call it as step ladder fever, where the fever is just increasing day by day. It is not touching the baseline, along with lot of abdominal symptoms, like patients will have loose motion, severe vomiting, then patients will have abdominal pain. So in this enteric fever also, we do some blood investigations like blood culture, which shows the bacteria called as Salmonella typhi grown in the blood. And then we give long-term antibiotics to these patients, because if not treated properly for adequate duration, the enteric fever might come back. So relapse of enteric fever is also seen. Then very commonly influenza or flu-like illness, where patients have upper respiratory symptoms like sneezing, runny nose, then headache, sinuses which are paining, then extreme tiredness. Patients will have complaints of cough, then some breathlessness will be there, reduced appetite. Then some patients, when they are not eating well, they might feel giddy, lightheaded. So influenza, there are various types of influenza. Like we had H3N2 swine flu, then we had COVID, then we had H3N2. There are various names of viruses, and there are every year we are advised or suggested to take flu shot, because the virus in that is different. So every year we have to take flu vaccine. So these influenza patients, many of the patients will have mild symptoms, will be managed well in the house with rest, hydration, SOS paracetamol. And after few days, the virus in the blood, the viral load will come down with good hydration. Make sure that any patient who has fever is losing water from the skin, and how much water that person is losing, we cannot count. So any patient with fever, very importantly, good hydration. If patient with fever is having body ache, it means that the hydration is not good. If patient with fever is having extreme nausea with reduced urine output, then hydration is a problem. So please, we have to make sure that any patient around us, or if we suffer from fever, we are going to drink a lot of water. It could be any simple water, coconut water, fruit, juice, tea, coffee, any fluid intake has to be, we have to be making sure that person with fever drinks at least 3 to 4 liters of water. And if this water intake is not proper, or if patient is losing water through vomiting or loose motions, then we have to supplement intravenous IV fluid, which we call it as normal saline or Ringer's lactate. Because if patient is put on IV fluid, then we can give 3-4 liters of IV fluid without patient knowing about it. So this is the way we treat dehydration in patients with fever. Then in monsoon related condition, what are the strategies for prevention and control? General precautions are, as we discussed, food, water hygiene. Then make sure that there is no stagnant water around you. If the stagnant water is there in the pots or in the bathrooms, please make sure you cover it properly. Then prevent mosquito bites, use mosquito nets, mosquito repellents, use full clothes. So these are general precautions. Then travel related precautions, like many a times in monsoon area, the nature becomes so beautiful that we all tend to go out on weekends, and the roads may be slippery. We go for treks there. The roads may not be very friendly. So definitely we have to avoid falls. Use proper support while walking, because the after rains, there could be some algae which has grown on the roads, which might make the road slippery. Then, while traveling, carry regular medicines, carry paracetamol if need be. And then we do see many patients with diabetes, those who are using insulin. They are checking their sugars on glucometer. So these glucometer strips, if they are kept in moist and damp environment, then they may show incorrect values. So we have to keep glucometers and strips in dry box. In summers, the issue is different, because in summers, the insulin has to be stored in cool temperature. So it has to be refrigerated. But in monsoon, the moist environment might give troubles with glucometer and its strips. So make sure that they are kept in airtight and dry boxes. And then there are some monsoon related illnesses which can be prevented via giving vaccines. So vaccines initially was only for kids, or it was only for newborn babies, but now adult vaccination is very important, and there are various vaccine preventable diseases in adults, and mainly they are monsoon related illnesses like flu shots. Monsoon is weather of flu. So flu shots once a year we need to take. Please meet your doctor and take a flu shot this year if you are not vaccinated. Then there are vaccines like cholera vaccine, typhoid vaccine, hepatitis A vaccine, and the list is long enough. So adult immunization is very important, and where we can prevent the diseases, but vaccines can be solicited. They cannot be compelled, as we advise our diabetes medicines, BP medicines. So vaccines are definitely, the cost of vaccine ranges from around 500 rupees to maybe 2-3,000 rupees. The vaccine for herpes zoster is little costly, but otherwise vaccines are quite affordable to most of our population. So vaccines, please think over it and prevent yourself from significant illnesses, mainly in the monsoon season. So let us welcome the monsoon with a smile and say bye to monsoon related diseases. Thank you so much. And now we can go for Q&A session. Thank you so much.
Thank you very much. Thank you very much, Dr. Purandare, for this session. Let me ask you a question about vaccines.
Sure.
And this is a slightly personal question as well.
Yes.
So do you think I would have perhaps saved myself of this cold and cough if I had taken a influenza vaccine?
Any vaccine would prevent the disease as such by 80-90%. And secondly, even if you get the flu after taking a vaccine, the complication rate would be very minimal and the severity would be very less. So definitely vaccines may not prevent the disease by 100%, but the symptoms would be milder and complication would be really zero. So you could have taken vaccine, maybe we could have prevented your present flu by 80% chance, 20% chance that you could have got it, but the symptoms would be very less, and we could have managed, means home management would be the definite after vaccination. So patients who have had taken vaccine, if they suffer from flu, they manage in house. If those who have diabetes, kidney disease, malignancy, and they're little immunocompromised, if they don't vaccinate themselves against flu, the chances that that virus will lead to life-threatening or critical illness are high.
And after after how many days of a cold or cough can one still take a vaccine?
After 2 to 3 weeks, you can take the vaccine.
After 2 to 3 weeks, so I should mark my calendar
accordingly. Yes, correct.
Doctor, there's a question from Shamala Ravi, who's not mentioned the age, but she's a regular on our shows. Nowadays, a sort of fever and cold is prevalent with lingering dry cough that lasts longer. antibiotics give less effect, what to do then?
A very important question, very commonly asked questions to consultants, physicians practicing and seeing such patients. So many of the times what we see that patients who have cough, which was preceded by fever, may not be always bacterial fever, may not respond to antibiotics. Because see, if bacteria are there, it will respond to antibiotics. But if virus is there, it will not respond to antibiotics. We may have to give antivirals like oseltamivir, Tamiflu, or sometimes it happens so that it starts with some viral disease and then ends up into a disease condition like of allergy. So here we have to give anti-allergic medicines also. So usually if patient is coughing for long, we do a simple blood test, which is called as hemogram or CBC, complete blood count. If the white cell counts are high, it means that this is due to bacteria and we give antibiotics. If white cell count is normal, then this is most likely viral or allergic. And sometimes it happens so that after chronic cough, the condition becomes like asthma-like thing, where we even have to prescribe bronchodilators. You may all be aware that asthma patients, they use some puffs. So these puffs where patients have to take the puffs, the medicines, they are called as bronchodilators, which dilate the airways, which are usually they have constricted because of the viral or allergic disease process. They dilate and the cough goes away. So patients who have chronic cough, they should consult doctor, do basic minimum test like hemogram. If sometimes our doctors advise chest X-ray, just to rule out a patch of pneumonia in the chest X-ray. And we give accurate medicines in the sense, if it is viral, then we don't give antibiotics. We give anti-allergic medicines. There are medicines called as fexofenadine. The brand names usually they are there quite a lot. Then there is anti-allergic medicine Montelukast, and then there are cough syrups which also help in such patients. So cough syrups, if cough is quite severe, then we even give cough puffs to reduce the cough.
Doctor, a question to you. At what stage of this cold and cough, the sardi khasi as they say, at what stage should one consult a medical doctor?
Yes, so cough and cold, which leads to extreme illness, where patients are feeling tired, they don't want to get up from their bed. And then these days, after COVID era, post-COVID era, we have the pulse oximeters also. So if oxygen saturation is little on lower side, 92, 93, there is a lot of wheezing. I'm sure all of us know what is wheezing. It is a cooing sound which comes after the cough. So if there is wheezing, there is high-grade fever, then patients not eating well, extreme tiredness, and then oxygen saturation little lower side, below 94, then I think it is good to consult a doctor, do necessary investigations, and follow the treatment plan.
Okay, thank you, doctor. There are a few questions on vaccinations.
Yes.
There's Girija Ganesh who asks, vaccine is valid for how long? That is, I guess the question is on the influenza vaccine.
So one year, influenza vaccine is for 1 year. Many vaccines, the effect lasts for 5 years. Some vaccines you have to take only single shot and it gives you lifelong immunity. Like there is a new vaccine for herpes zoster, Shingrix, and if you take one vaccine, then it gives lifelong immunity. So every vaccine, the duration would be different. Some vaccines we have to take it at 0, then 3 months, 6 months. So it varies with individual vaccines.
Right. Thank you. Doctor, there's a question from Richard Gomez, who's 70. His question is the use of a nebulizer safe in patients who do not suffer from asthma? I've been asked to nebulize with some vials when I have had bad flu.
Yes, so sir, you are absolutely right. And as I told you that there are puffs, nebulizer is a gadget or it is a machine which delivers some liquid medicine into your lungs. And these usually medicines are bronchodilators, which dilate the bronchi airways, and they might also have steroids, mild steroids. But steroids, when inhaled inside the lungs, will reduce your cough. Rather than taking steroid tablets for the cough, which will have some side effects in the form of little increase in the blood pressure, blood sugar. But these inhaled or nebulized medicines, they act only on the lungs. So they have a targeted approach or targeted therapy where your cough would be less and the side effects would be minimal. So nebulization definitely is advised when patients have chronic cough, which is not getting better with routine therapy. We advise nebulization for patients.
Right. Doctor, a couple of more questions on vaccination.
Yes.
One is from Brijendra Kumar, who's 78.
Okay.
He wants a little more elaboration on the vaccines to be taken before the onset of monsoons. The other is from an anonymous attendee who asks, does the vaccination not reduce our immunity power?
Second question, please.
Does the vaccination not reduce our immunity?
Okay. So, sir, vaccines are basically when we give a vaccine, the antibodies are produced against that disease as such, which protect from that disease. Like if we take flu vaccine now, flu vaccine basically the inactivated viruses will be injected in my body, and my body will produce antibodies against those viruses, which will prevent me in getting other flu episode, or which will prevent me in getting complicated flu in future. So basically, vaccine definitely will not reduce the immunity, rather it will improve immunity by producing antibodies in our body. And the first question by Mr. Brijesh Kumar is, can I see in the chat box?
Please elaborate a little more on the vaccines to be taken before the onset of monsoon.
Yes, so vaccines which you can take, one very importantly is flu vaccine. Visit your physician and get prescription of flu vaccines. There are many brands which are available in your local area. Get the flu vaccine shot. So once in a year before monsoon starts, you get that vaccinated. If you are traveling to any area, then typhoid vaccine, cholera vaccine, hepatitis A vaccine, there are various injectable as well as oral vaccines which are available. So you have to, if like patients are traveling overseas, in the US, then they have to take Tdap vaccine, which is then measles, mumps, rubella vaccine. Various vaccines are to be prescribed. But for you, when you are in the age group of around 70, then flu vaccine is the only vaccine which you can take around monsoon area. And if you wish to travel overseas, then there are various vaccines which are indicated for you. If you have diabetes, then there is vaccine called as hepatitis B vaccine. Then there is vaccine called as pneumococcal vaccine. Pneumococcal vaccine, we all know that there is a type of bacteria which is called as pneumococci. They lead to various infections like pneumonia, upper respiratory infections, then pneumonia causing septicemia and mortality also. So pneumococcal vaccine, influenza vaccine, hepatitis B vaccine is indicated if patients have diabetes. And in elderly group, there is a vaccine, as we discussed, that chickenpox vaccine is there. Vaccine for herpes zoster is also there. And there are various vaccines which are available to prevent the disease. So better to consult your physician nearby and ask the list of vaccinations you need to complete, you need to take. But pre-monsoon, remember, flu shot has to be taken. One.
And how many weeks before the monsoon? So typically in Western India, for instance,
Yes.
in a Mumbai or a Pune, the onset of rains happens in June.
Yes.
So when should one take the vaccine?
June, July is good time to take the vaccine.
June, July is a good time to take the vaccine.
Yes.
Fine. Thank you, doctor. We have a question from Mr. Brijendra Kumar again, who has complimented your presentation. What will you advise for prevention of and cure of widespread viral fever? Is there something that you would, I know you mentioned that in your presentation, but is there something that you would, advise on viral fever as such?
Yes. So viral fever we get usually airborne, where we are inhaling those viruses, or we can also get from our hands. So hand washing is very important. Then if you could use mask, which we were using happily in COVID era, but now we have left using those masks. But if you see that a lot of viral fever patients are around you, in your family, in your neighborhood, then you can use the mask. Hand hygiene is very important. Wash your hands. You can use sanitizers also if hand washing is not feasible. And healthy food, and good vitamins, mineral support. When we eat fresh fruits, we get good vitamins, minerals. So basically, food will maintain your basic immunity. Then, if you could use mask and hand hygiene, that could, in addition, will give you more immunity. So that is how we can look at it.
Thank you. We have a question from Vijay Kumar Sharma. He's not mentioned his age, but he says he suffers during the rainy and cold weather by sneezing, nose clogged, running nose, and so-called hay fever. It is said to be
Hay
due
fever.
to allergy. What should he do about it?
Yes, so many times we have seen patients suffering from allergies, lot of allergies like pollen allergies is there, some food allergies is there, then chemical related. If there is some cement work is going on in the neighborhood, then patients, they come to us with lot of sneezing, lot of cough. So it is your body's susceptibility to a allergen. And this will manifest in various forms, like allergic rhinitis means it will be like runny nose. Allergic pharyngitis means sore throat or itching in the throat. Allergic conjunctivitis would be in the eyes. Allergic laryngitis would be, or allergic bronchitis would manifest as cough. Allergic dermatitis will have some manifestations on the skin in the form of itching. So a lot of allergies, and it is body's tendency to have these allergies. And we have seen that patients, they sometimes they check for allergens. Like there are some injections, they inject onion extract, potato extract, tomato extract in your skin, and they see the induration, and they will tell you a report where you are allergic to 10 things and avoid those. But we have seen in clinical practice that if these 10 things are avoided, then patients develop allergies to rest 10 things. So doing that allergy test may not be fruitful in all patients. You just have to remember that I have allergy to some items, and better to prevent those allergens at present. So if patients classically give history of dust allergy, while going out they feel sneezing, so we tell them to use mask again. So if patients in Ganesh festival season, many patients, they come to us with allergic bronchitis, because we all know that there is a grass which is called as Congress grass, which the time of pollination of that grass, and then a lot of patients have such allergies. So allergies, if they are severe, then we give anti-allergic medicines like montelukast or cetirizine, levocetirizine. Even some patients we give strong anti-allergic medicines, including steroids. But some patients, if they have mild allergy, only preventing those allergens will help them. So for answering him, hay fever or allergies, just to prevent the allergen. If mild, then manage in the house. If severe, then take anti-allergic medicines by consulting the doctor.
Even as we have a few more questions which we will address to Dr. Purandare, those of you who have been listening to this session and are not able to take notes because this session has loads of info, please do remember that the edited video of this session plus the takeaways written by a medical doctor will be on seniorstoday.in on Monday evening. So please do look at that. You can watch the entire video once again and take your notes and remember what she has said. Doctor, you mentioned about vaccination and the various forms of vaccination. I know this question is not really for this session on monsoon-related illnesses, but there were a couple of questions. For instance, Sangappa Koti says, is shingles vaccination necessary? We do see a lot of ads by Mr. Amitabh Bachchan on this.
Yes. So basically, shingles is herpes zoster. What is herpes zoster? In our childhood, we have suffered from chickenpox. So chickenpox virus stays in dormant phase in our spinal cord, and it is activated in the form of herpes zoster. So herpes zoster usually in dermatomal shape, like it starts from the back, and in one area of your back, you will get a lot of vesicles, pain will be there, and that reactivated virus will have some impact on your skin and your nerves. So herpes zoster, as such, the life-threatening potential is less, but it has got some morbidity with it. So if patients are immunocompromised, if there is history of chickenpox in childhood, and if there is history of herpes zoster once, then it is always better to have vaccine to prevent the second episode. though herpes zoster may not be life-threatening in all patients. So mortality part is less, but morbidity is more. What is morbidity? Severe pain in that area. So that's why in Marathi, if you are aware of Marathi language, it is called as Nagin. Nagin means a snake, because the pain in that nerve area is so severe that patients, they cannot sleep in the night because of the severe pain. So herpes zoster virus in elderly population after age of 50 is indicated, but the cost is a little problem in some patients because the cost is around 15,000. So not all will be affording that vaccine, and in insurance companies, they may not be giving that. So herpes zoster virus definitely for immunocompromised patients, those who have diabetes, kidney disease, heart disease, those who have history of malignancy on chemotherapy, patients with HIV, they should be taking this vaccine because the immunity part is less to prevent herpes zoster in future.
Yeah, thank you. There is a question, in fact, by Katie Daranchi, who is 72, and she says she had chickenpox for the first time at the age of 65.
Okay.
Her question is there a possibility that she can get herpes later on?
Yes, those who have had chickenpox in the past, they have the risk of getting herpes zoster in future. So what we should do to prevent herpes zoster is to make sure that we are eating healthy, we are doing regular exercise, we are taking care of our immunity. So where the immunity gets compromised, where we fall sick, where even a lot of mental stress also has been one of the reasons for herpes zoster. So stay happy, stay healthy to prevent herpes zoster. And if you could get a herpes zoster vaccine, you should be taking it to prevent it.
Thank you. We have a question from Girija Ganesh, another question she's 63. Her question is, does a flu vaccine have any side effects if taken every year by senior citizens?
Yes, so flu vaccine is basically inactivated virus which we are injecting. So some of the patients whom we give flu vaccine might give some flu-like symptoms as side effect, like mild fever, mild body ache, mild sneezing, or cold-like symptoms. So mild symptoms similar to that of flu patients may get after taking flu vaccine, but they are well managed in the house. With some patients might need one paracetamol tablet just to get the pain alleviated and the fever part little less. So very rarely flu-like symptoms as side effect of flu shot, and can be managed by 1 or 2 tablets of paracetamol. That's it.
And this a question from Mr. Shrikant Kulkarni, who's 71. Do vaccinations reduce the platelet count?
Not as such. Not as such. Known entity is not there. Vaccines reducing platelet, no. Vaccines might give rise to the disease as such with mild, like if we give flu vaccine, then flu-like symptoms can be there. We must have taken COVID vaccine, and not all have suffered with flu. So it is basically inactivated virus which we are injecting. But platelet count, it does not have any effect on platelets as such.
Doctor, we could go on and on, but I'll just take 2 more questions. We normally don't take questions from non-seniors, but this one is interesting. This is from Mr. Jayasuriya Das, who says, a slightly lateral question, but I'm not yet a senior citizen by strict definition. I don't know what that means. But would like to know.
Age is just a number. All of us, age is just a number. So all of us are young. I don't think that we should be, yes.
You would like to know from what age should everyone mandatorily do annual checkups and lab tests?
Very important and similarly very tricky question. Because in the past, when I was doing my MBBS, MD, we were taught that diabetes is a disease after 40. But here we are seeing in the age of 12, 15, 16, type 2 diabetes, which is diabetes which we see in adults. So now age is nothing. And if you have any symptom, you proceed for your annual checkup. Like if both parents have diabetes, age of parents is 50, 52, then even the kid is 20-year-old. If the kid is obese, we ask the kid to check sugar levels or HbA1c level to rule out pre-diabetes. So annual checkup as such, if you don't have any symptom, If there is no family history of any major illness, then you may start after age of 40. But if there is strong family history of any disease as such, as I told you that parents in the age of 50 and children in the age of 20, if obese, and if have some signs of like acanthosis nigricans, which is hyperpigmentation of skin at the nape of the neck, we even ask them to check their glucose levels and HbA1c, which is average of 3 months, starting from the age of 20 itself, or even 15 also, for that matter. So initially it was that start your annual checkup after 40 for diabetes, blood pressure, heart disease. But now we say that if there is strong family history, if you are obese, if you have any symptom, then start early also.
Right. Thank you, Doctor. We have come to an end of the questions. There are a few questions on diabetes, which I know Dr. Purandare is from a specialized diabetes institute, but I'm not going to take those diabetes questions. Doctor, one last question. There are questions about tonics, etc. That people, somebody has asked about tonics for somebody who's recovering from diarrhea, but even otherwise, this entire thing about immunity boosters, having like somebody advised me, why don't you have a Chyawanprash, right? And there are these sugar-free Chyawanprashes that come, and various other kadhas, etc. that are there. And I'm sure you must be coming across these cases now. Would you, as a doctor within allopathic practice, recommend these immunity boosters to have, and what kind of immunity boosters should one consume?
So, Mr. Pradyuman, as you rightly said, that I am practicing allopathy, and allopathy is evidence-based medicine. So, what is evidence-based medicine? If there is deficiency, treat it. If there is no deficiency, don't give it any. Don't supplement it. So, if we find vitamin B12 deficiency in a person, we would give vitamin B12 to that person. If we find calcium deficiency in that person, we would supplement calcium. If we find vitamin D deficiency, we would give vitamin D. So if there is deficiency, if we find out if a person is having bleeding in the gums, then we would give vitamin C. If person has stomatitis or ulcers in the mouth, we would give vitamin B complex. So if there is deficiency, if we see it, then we treat it. But otherwise, we believe that if we are eating healthy foods, where our meal plate 50% is full of fibers in the form of vegetables, fruits, then we are eating good amount of proteins, we are eating healthy, balanced diet, then that should give us all the recommended vitamins and minerals which we need. But if there is documented deficiency, we treat it. But otherwise, we don't want to give multivitamin blanketly to all population as such. But to tell you very frankly, the vitamins, there are two types of vitamins: water soluble vitamins and fat soluble vitamins. So fat soluble vitamins, if they are taken into excess, they might harm us also. Like vitamin D is fat soluble vitamin. We have seen toxicities also. So just don't take blanket vitamins as such by just going to a pharmacist and just taking it. Consult your doctor before taking any vitamin also.
Doctor, I have this vitamin C over here to chew. Is that something which I should take, or
absolutely,
should
I? Absolutely, because you have flu. Vitamin C in high dose is found to improve the convalescence in flu. And second thing is vitamin C is water soluble vitamin. So even if it goes into excess in your blood, it will be passed in the urine. So I'm not worried. Please go ahead and take it.
Thank you, Doctor. I have kind of slipped in a few personal questions as well, but when you have a doctor in the house, one needs
absolutely.
to.
I would love to become in-house doctor for seniors today. Yes.
Thank you very much
yes.
For this session, Doctor. As you've seen, there have been quite a few questions that have come in. Over 20 questions you've been able to address, and there are more questions coming in. It was really a very enlightening and informative session that you've had. I must thank you for taking time out. I know you had your OPD at the hospital, and thank you very much. And thank you to the Chilaram's Diabetes Institute for helping facilitate this. As you are all aware, Health Live at Seniors Today is a weekly session that we do every Saturday at 5 p.m. You can set your watch as per that. We start at 5 p.m. sharp. and we have a session on various ailments. We have, of course, done a few general sessions as well, like we did last week on polypharmacy. But we have these sessions every week, and you can join in. You can pre-register. The pre-registration link is there in the chat window. As you know, part of Seniors Today is now the very popular Evergreen Club. So we do a lot of sessions other than the health webinar and our flagship event, the Seniors Have Talent. We do a host of events every day in the morning as well as in the evening. You can attend all these sessions through the Evergreen Club app, which is downloadable on Android as well as Apple phones. You can be there. We are also going to be starting some courses. As you know, all of these things are available free of cost, including the magazine. We've had 50 issues of Seniors Today magazine, which have been published. And these are all available online, and you can have a look at it. What I'm going to do is, Doctor, if you don't mind, I'm going to request our producer to just play the video of the latest issue of the magazine, which is just out on the 15th. So this is an issue which is just out on depression. So as you can see, Seniors Today magazine is not just about pensions and health, etc. It's also about lifestyle issues like unusual places to stay. It's also tackling real issues that concern senior citizens, like erectile dysfunction. Okay, so these are issues that we discuss, and it's a magazine that has been published from July 2019. You can access the current issue, which we have just seen, as well as our archives on our website, seniorstoday.in. There is content that is refreshed every day, and we have a newsletter at 6:30 in the morning, which you can again set your watch by, and it will be delivered to you Monday through Saturday, and of course a host of activities that we do. Once again, thank you, Dr. Vedvati Purandare, for this session, and we would love to have people from your hospital once again on our session, and thank you once again.
Thank you so much for inviting me. It was a pleasure.